Have you ever wondered if employee wellness programs save you any money as an employer? Well, this is the video for you. Let's go into some of the background on how important lifestyle medicine can be in your workplace, because if you don't make time for your wellness, you will be forced to make time for your illness. So what we want to do is work with you to create and support the vision of healthy, vital employees so that you can have reduced absenteeism, reduced presenteeism, reduced healthcare expenditure. This is what we want to do, and work with the foundation that you undoubtedly are already building. So working closely with the HR department so that you are the ones that know your people, and I am here to listen to you, to create the content and to work with you based on what has worked well and based on where the need is, what your people want to hear, and also what your statistics say that we need to focus in on. So let's talk a little bit about this, because we know that chronic disease is the primary driver of healthcare expenditure. $4.9 trillion per year last I checked. What are chronic diseases? You know them very well. Our number one killer, heart disease. Our number two killer, cancer. We've got diabetes-related conditions. Those things cause about 10% of our healthcare expenditure. And then, of course, other things related to risk factors, obesity-related conditions, high cholesterol, high blood pressure, and the list goes on, right? So when we look at that, we really want to ask, rather than just saying we got bubble packs managing all of our medications, yes, keeping these conditions managed is important, but wouldn't it be more important to address the root drivers of what's causing these conditions? What is that? What are we actually dying of? Yes, we're dying of heart disease, of cancer, of diabetes-related conditions, and so on. But why are we getting those things? And if you look at this article published in JAMA in 1993 called The Actual Causes of Death in the United States, it said that 80% of the time, the reason we're getting these chronic conditions depends on what we do with our feet, our forks, and our fingers. That is, are we moving, what are we eating, and are we smoking? And those three things contribute to the environment of what can turn our genes on or off. That's epigenetics. You know, we didn't solve the genome, we didn't solve cancer, we didn't solve any chronic disease crisis when we sequenced the genome. Why? Because genes can turn on or off like light switches. And whether or not they drive disease and when they drive disease is really dictated by the environment where they find themselves. The feet, the forks, the fingers, the culture, and that environment that nudges why these diseases might be being triggered. So let's talk about our top causes of healthcare expenditure. Heart disease, our number one killer. Yes, this is high. We talk about this. This is where lifestyle medicine probably has the most evidence behind it. Look at the work of Dean Ornish. Look at the work of so many other pioneers in preventive cardiology. It's really the utilization of our lifestyle to prevent, to treat, and even reverse some chronic conditions, and heart disease is really where we have tons of evidence. But let's talk about cancer, because this is not talked about quite as much. So cancer, our number two killer. Of course, cancer is not just one thing, it's a myriad of things, and not all cancers are created equal. But it is the second highest cause of death in the world. And what we know about cancer is that 50% of all cancers have a modifiable risk factor. What does modifiable mean? It means something we can change. In that there is power. I think so often we feel hopeless in the face of cancer, but in fact, 50% of all cancers have something modifiable that could contribute to either prevention or better outcomes after treatment. So obesity is linked to 25% of all cancers. Of course, you've probably heard, but let's break this down. What other lifestyle mechanisms could contribute to cancer? Tobacco, probably not a shock, but tobacco. And so really incorporating programs that help people quit smoking and help with stress management is really big. Why do we do what we do? If we just point out that tobacco and we don't ask the why, where are we doing it, we're not going to get as far. Alcohol, same thing. Why do we do what we do? So alcohol is a known contributor to many cancers, especially breast cancer, at any serving, I'm afraid, or at any portion. Low fruit and vegetable consumption is linked with much higher cancer rates. Lack of physical activity. So those things, tobacco, alcohol, low fruit and veg consumption, and lack of physical activity accounts for 1/3 of cancer diagnoses. Whoa. And less than 10% of cancers are linked to a known genetic cause. Wow. So that doesn't mean we know all the genes that drive cancer, but we do know that we can help support with a myriad of lifestyle medicine-based evidence to address the root drivers and help our body switch those cancers off. We also know that your metabolic health is closely tied with cancer. What does that mean, metabolic health? Well, things like insulin resistance. So we have to think, oh, what does that mean, insulin resistance? Insulin is the key that unlocks the door to allow sugar into the cell, right? Insulin does not just apply to diabetics, it applies to everyone. And everyone wants to help support their metabolic health so that they can more effectively bring sugar into the cell and not allow that insulin resistance to clog up that keyhole so that sugar starts to then increase up in the bloodstream over time. So we want a lifestyle that helps us utilize that sugar more effectively. So when we start looking at a cancer prevention program, we have to look at metabolic health. These are not separate diagnoses. They go hand in hand. There is not one lifestyle for one diagnosis and a different one for other chronic diseases. It's a hand in hand, and we have to look at those roots. So a good cancer prevention program will also be one that helps prevent and reverse metabolic disorders like diabetes, prediabetes, insulin resistance, and so on. So we've got to focus on the reduction of insulin resistance through nutrition, through movement, through sleep. Again, it's never just one thing. Stress management. If we're always in the stress state, it's very hard to bring those sugars into control. So we've got to look comprehensively, and we have loads of evidence to help us do that. We have to address other contributors to cancer, not just insulin resistance, but inflammation and gut health. Yes, gut health. That is supporting the microbiome, a pivotal influencer in creating the environment where your genes find themselves. And so when we look comprehensively at a wellness program, we want to look at all of those pieces and then personalize it for your needs. So let's look again at the top diagnosis. Heart disease, #1 killer. We've talked about that. But now looking at cancers, what are our top cancer diagnoses? We've got breast cancer, prostate cancer, colorectal cancer, and lung cancer. Those are going to kind of fall into the highest cancers. And the great news is that we have a lot of evidence on those particular cancers as in terms of the impact that lifestyle can have. Let's just take just a few summary points here where the best evidence is for, say, prevention and better outcomes in breast cancer is through increasing physical activity, including and supporting breastfeeding. So this is, again, supporting women at all stages of life in your workforce is so key. Breastfeeding is so key, not just for the child's health, but for the woman's health. Maintaining a healthy weight. So again, looking at metabolic health. How do we do that? Nutrition, movement, stress, sleep, and so on. Avoiding alcohol, I mentioned already. For prostate cancer, look at the work of Dean Ornish. Through a lifestyle-based program, Move More, Stress Less, Love and Connect More, Eat Well, those major pillars, he showed 500 prostate cancer genes to switch off the growth of prostate cancer. Pretty amazing, right? What do we specifically want to focus on for prostate cancer prevention and better outcomes based on best evidence is weight management and healthy nutrition. And look at colorectal cancer. Well, we see that if we can reduce and replace processed meats and red meats with high fiber foods, That is whole foods, whole grains, fiber. This is key. Where do we get fiber? Whole plants, baby, colors of the rainbow, and a bed of greens by the side of beans, and don't forget the whole grains. So replacing those high saturated fat, those processed meats with high fiber foods, removing ideally or replacing alcohol, supporting healthy weight, and supporting dietary calcium specifically has been shown to be beneficial in colorectal cancer prevention and outcomes, as well as physical activity. So those are the kind of main bangs for your buck that you really want to focus in on if you're trying to reduce cancer rates. And of course, it's never just one thing. We have to look at the roots in order to prevent these weeds from popping up again. But we have to recognize this goes in the context of the environment. We are not talking from a message of blame, but from one of power. So in that, we've got to help support the built environment to nudge healthy decisions, to nudge healthy behaviors. We need workforces where there's a healthy option is the easy, accessible option. What do we have available to eat? How supported are we to learn how to cook healthy food if this is something foreign to us, as it is to most people in the Western world, right? Do we have access to the food? Do we have the education and the support to reduce barriers that we so commonly find both in the individuals but also in the environment? Do we have an environment that nudges movement, that healthy, safe movement, and it's part of the culture? Do we have a culture where we feel connected and supported, as in we are part of the tribe? All of those things make a big difference when we're addressing the root drivers of what we can do in the workplace to nudge the easy and accessible option to be the healthy and maybe even fun and uniting option. So the key pieces that you want to include that need to be personalized for you and your wellness program is, of course, very similar to that Dean Ornish approach, right? Move more, stress less, love and connect more, and eat a healthy diet, right? Eat well. So we've got to have education in nutrition. There's a lot of confusion, and we need to teach people how to use their food as medicine and give them easy, accessible, not overwhelming, and undeniably delicious ways to do that. We need to address the why we do what we do. That's mental health, right? Stress is so often an impeder in us doing those feet, forks, and fingers. So how can we support our people to feel less overwhelmed? How can we support their sleep, their mental health, anxiety, depression? These things are linked hand in hand. If we feel lonely, it's the equivalent of smoking 15 cigarettes a day in terms of chronic disease risk. So how can we create a culture that is truly one of support, where people feel more connected to each other and also mentally more healthy? Movement's got to be part of that. That one is often being done in workplaces, so I won't touch on that more. But also, again, that culture and sense of community that will help people feel supported to address any of the habits. And of course, we've got to track the lifestyles, and we've got to see the impact we're making, and we've got to listen to the employees to understand how we can meet their needs and in what formats and what does it look like and what they feel like would support them. So that's kind of how the program needs to roll out, to be in close partnership with the HR team who knows the employees very well. We've got to also know that the C-suite's got to be involved. If they're not part of this vision, it's very hard for them to understand why are we spending money on this?